Good morning, good evening, and good afternoon, wherever you are in this world. Thank you for joining us today. Here is Wajdan Jarrah, and I'm the regional representative of the Resource and Support Hub in MENA region, and I'm also regional representative with the network called Network for Empowered Aid Response, NEAR. If I may to start, I would like to start by highlighting what happens in natural disasters. Responding to national disasters requires considerable efforts, even more when it's a complex crisis. During emergencies, it is essential to avoid causing any harm, even when working with limited resources. There should never be an excuse for sexual exploitation, abuse, and harassment, or any form of harm. The Safeguarding Resources Support Hub has taken some steps to support non-governmental NGOs in responding to the devastating earthquake that struck Turkey and Syria recently. And before we start, please allow me to express our deep sadness and sincere condolences to the families who lost their loved ones in the terrible earthquake from Syria and Turkey. Our webinar today is part of a series of activities during this crisis. The webinar describes safeguarding and provide clear, particular guidance on how to operate during time of emergency to avoid doing any harm. It will also highlight the impact of potential trauma on staff during emergencies. Lastly, the webinar will address the role of donors in supporting safeguarding measurements during emergencies. In order to do so, we have invited Ms. Claudia Zell as a safeguarding consultant to guide us throughout some steps about what we need to know and what we need to do. Claudia has over 13 years of worldwide experience in program and team management in the humanitarian response and international development. She has developed extensive experience in protection from sexual exploitation, abuse, and harassment, in addition to safeguarding, including setting up organizational safeguarding standards and frameworks, case management, and capacity development for national and international organizations. She is also a trained investigator, particularly in complaints related to the sexual misconduct and workplace harassment, and is continuously undergoing further trainings in this regard. She is an engaging facilitator on various topics. She is also a certified counselor with a specialization in art therapy and post-trauma counseling, and has technical expertise in mental health and psychosocial support in complex emergencies. She holds a master's degree in intercultural conflict management and is a certified mediator. Welcome, Claudia, and thank you for accepting to be with us today. I would like to start with the first question to you, Claudia, which is, as a humanitarian and governmental organizations, what we need to know about safeguarding in times of emergencies.
Thank you so much, Wajdan, for the warm welcome, and welcome to everybody. Before I go and answer your question, Wajdan, I would love to go back a little bit to the definition of safeguarding, so we are all a bit on the same page. The next slide, please. So I used the definition of the Safeguarding Resource Hub. So when we talk about safeguarding, and I know we have a lot of safeguarding specialists also within the panel, so it's probably nothing new for you, but it's important we are all at the same page. So safeguarding is an ethical approach and a set of practical measures adopted by organizations to promote the safety and well-being of everybody involved in the delivery or receipt of humanitarian aid and development assistance, and to protect them as far as possible from all forms of harm, including exploitation, abuse, and harassment that might result from their involvement in or contact with the organization. To unpack this definition a little bit, what we see, these are really practical organizational measures, and it's the objective is to promote the safety and well-being of everybody involved. So we are talking about the workforce, but we're also talking about the affected population. So everybody who comes into contact with the organization. And it's to protect them from any sorts of harm. So it is a huge focus on exploitation or sexual exploitation, sexual abuse and sexual harassment, but there are also other forms of harm that safeguarding includes, like every harm that is committed towards children, but also other types of physical harm that are not necessarily sexually connotated. It is really, when you look at the two symbols, it's really about keeping people safe, but it's also about addressing the harm that has occurred, sometimes unintentionally. And when we talk about addressing, it is not just investigating cases or responding to incoming concerns or complaints. It's also about, as an organization, to learn from certain gaps that you might have in your procedures. So this is something I wanted to show you. And on the next slide, I included this as well. We do have already quite a lot of standards in the international community when it comes to safeguarding. Some are addressing safeguarding really directly, and some are doing it more indirectly. So we are all aware of the core humanitarian standards and its 9 commitments. There's a lot of commitment to the accountability towards affected population, which includes prevention and protection of sexual exploitation, abuse, and harassment, but also other safeguarding elements. We are all aware of the Interagency Standing Committee guidelines and the minimum operating standards and procedures. We know the Keeping Children Safe standards, and I also put on the very right corner of the slides some standards that are not directly safeguarding standards, but they are addressing it in a more indirectly way. So everybody who works in the humanitarian sector, we know the SPHERE standards. It's our book. It's the book when we work in humanitarian assistance. And it's very technical, but in each technical chapter, if you look at it, there are also ways that guide you in how to design and operationalize your missions and your technical interventions in a safe manner. The same for the minimum operating standards on child protection. And we know child safeguarding or safeguarding is not the same as protection, but nevertheless, it is good to look at those standards because they also tell us a lot about certain risks that particular groups might face, and that's something we can take up as the safeguarding sector as well. Similarly, with the humanitarian inclusion standards for all the people and people with disabilities, and not to forget people that are chronically sick. All these standards, and we can click, have one thing in common, which is the key principle, which is the do no harm. Mace, could you please click? Yeah. So every standard has this in common, and this is also the standard for safeguarding. Yeah, so this was something I really wanted to show you. And in order to come to your question, Weshdan, what can we do? Next slide, please. Or why safeguarding is actually so important. Next slide. So I used some images that quite speak for themselves. In an emergency, I mean, we know that a lot of risks have already existed before an emergency has started. But in an emergency, we know from research or from past emergencies, and we also saw it now in the recent earthquake, we do have a huge number of unaccompanied children. And this is either because
Claudia, sorry to cut you off. Would you please just slow down for the interpretation?
Of course.
Thank you. Thank you very much.
No, of course, I speak slower. So we know from research, and we could see it also in the recent earthquake, that we do have a higher number of unaccompanied children. And this is either because they lost their caregivers, or they got separated from them because of displacement, or institutions that were initially taking care of them are no longer existing. We do have also people with physical disabilities, not to forget people that are mentally also challenged and much, much more difficult to detect, but they are at a high risk of harmful behavior. We do have already existing groups that are vulnerable and marginalized, as you can see on the picture of the women. And often women become again displaced, or they are put in shelters with no privacy. I remember a situation in Afghanistan where a woman was put in a tent, a single mother with a newborn, next to a house with 5 or 6 single men. This should not happen, because this woman was not able to use the toilet in the night because she was afraid to go out. So these are already existing risks that we have, but that get increased in an emergency. We also have, and we blurred the face, but on the bottom, we also have elderly people, and they also need to be safeguarded because they are also running into risks. We also have chronically sick people that need to be safeguarded, because if you are chronically sick, you rely on your medication, and it makes you much more vulnerable towards exploitation. And I also used another image, which I think is also important to mention, is that during natural disasters, but also during man-made or human-made disasters, we also notice that a lot of facilities or institutions like churches or mosques get destroyed. And these places are very important for people to stay internally peaceful, or where they gain their strength. And we know that they find their ways of still continuing their prayers. But if these institutions are destroyed, and we are also talking about community centers, research was showing us that people are resorting to more harmful behavior if certain elements that give them strength in their daily life are not existing anymore. And last but not least, not to forget, are our first line responders and the rescue teams that we have. So we have to safeguard them, but they also can pose a safeguarding risk to the population. Next slide, please. And you can, yeah. So again, to sum up a little bit on why safeguarding is important in emergencies. We know in humanitarian settings, safeguarding risks diversify and multiply, and affected people are at increased risk of various forms of harm. As I said, especially children or people with disabilities. It is known that violence against children increases in emergencies. And it is also known that sexual exploitation increases. So sex for work, sex for food, sex for cash, or sex for medication. Next slide. And we also know that on behalf of an organization, internal factors in an emergency also are different than in other circumstances. So we do have a lot of rapid recruitment. We have a high staff turnover. We have more inexperienced staff. We have distance supervision. We have working through partners that we maybe have not worked with before, or governmental structures. We have a high amount of insecurity, and we have a lot of work pressure. And this results in huge internal safeguarding challenges. We know that the physical and mental well-being of staff is also important for safeguarding. Everybody who works in safeguarding knows this. But we also know that stressed and exhausted staff are more at risk of resorting to harmful behavior, which is very, very likely in humanitarian settings. And then again, they are less likely to notice and report safeguarding concerns. And again, we also know that there's often a great deal of reliance on volunteers in humanitarian settings, and it's easy to forget that they also need to be background checked. Yeah, next slide. So we have in Vechtan, you wanted to, I saw you looking at me, no? So what are things that we actually can do? If we look, for example, at my last mentioning of the influx of humanitarian workers and also volunteers, it really guides us immediately to what is important to do. And one of the key elements is safe recruitment. And it's really, we cannot imagine how important it is, yeah, because we do have an increase of new staff in emergencies, and often we have to deploy people very fast. So our recruitment procedures are often shortened. We have the influx of volunteers, we have the influx of humanitarian workers that are very unfamiliar with certain contexts. And it's often assumed that humanitarian safeguarding work can be done by the existing safeguarding team or focal point. And I can tell you out of experience, this is not the case. You need to plan for additional resources because you cannot overwhelm a focal point that normally is not 100% dedicated to this position to do an emergency on its own or on her own. So you have to follow also the whole cycle of safe recruitment. It is important to mention safeguarding in your advertisement. It is important when you shortlist your candidates to already, when you invite them for the interview, to share your code of conduct and your policies and make it an integral part of your interviews. Ask safeguarding questions and don't ask questions about knowledge. We often have the tendency to ask, can you explain me what exploitation is? This is not telling you anything. Yeah, because people can read this. You need to get to the attitudes. You need to confront people with certain scenarios and see how they would deal with it. When you go into the contracting, make sure your code of conduct is signed, and it's not only a signature, it's making sure people understand what they sign. Yeah, and orient them well. And we use a lot of online tools to do this. And it's understandable because especially big organizations that are hiring quite a lot of people, we don't have the time to engage with each and everybody bilaterally. But it is important once people are deployed to also physically and face-to-face engage with them, because an online training cannot tell you enough, because you can click through the slides, maybe you are lucky and you answer all the questions right and you get your certificate, but it doesn't tell you anything about if the people actually really understood what they are supposed to do. So never safe recruitment practices should be compromised by any reason, including the demand from a donor to urgently fulfill a position. You have to go through your steps, and it's an investment at the beginning, and it maybe takes time, but it saves you time later on. Next slide, please. Another very important element that I would love to share with you, and I know it's quite a lot of input and we cannot really do a deep dive, but it's assessing safeguarding risks. It's crucial. And I have seen a lot of risk assessments being conducted during emergencies, looking at various risks, but they are not addressing safeguarding risks. And it's really, really important, especially while operating in an emergency context. We know that we have changing dynamics and there's a broad range of risks involved. So a risk assessment should be reviewed on a regular basis throughout your emergency program cycle. It's nothing that you do at the beginning and then you put it away. And you have to consult with all the staff. Yeah, not only the M&E people, but really engage with staff, especially with the staff that are in direct contact with the affected population. Again, and I cannot stress this again and again, include people from your community, various people from different members of the community. So community engagement is key. Yeah, and we tend to forget sometimes in emergencies, because we are all stressed, how important it is to listen to people. And again, also coordination is key. Particularly when it comes to safeguarding risk. There are a lot of organizations working with the same communities. You don't want to go to the community members and ask them the same re-traumatizing questions over and over and over again. Yeah, so join forces and share your risk analysis among each other, because there's no competition. Yeah, because no matter in which sector we work, the safeguarding risks need to be addressed. Next slide, please. And again, also very important in emergencies, when you do your risk assessment, you have to categorize your risks and consider the likelihood. So what is the probability that the event is occurring? And also the impact, so how severe the harm could be for an individual or for the organization. And why am I saying this? Is because in emergencies, you have a lot of risks, and you cannot mitigate and reduce every single risk, even if we want to. So we do have to prioritize the high risks and immediately discuss them and ensure their mitigation measures are in place. Another important point that we also sometimes tend to forget is you have to assign responsibility and make the risk owner aware of their responsibility. So when you do your risk analysis and you have defined certain risks and you have defined mitigation measures, make a physical human being responsible for it and assign this responsibility. And again, also brief and update your senior management. You have to have their buy-in, they need to understand. And one important point as well is pay attention to programs that are set geographically in isolated workspaces, or where employees working in small groups with fewer opportunities to interact with the main office. Yeah, so this should alert you, and you have to pay more attention to those particular programs in isolated regions. Next slide. I wanted to show you this quickly, and I think Veshtan and the team are also going to share the tools in the chat box, but there is a risk assessment tool developed by the Safeguarding Resource Hub in a very community-based and participatory way. And it's a tool that is very user-friendly, and you can adapt it to your context and use it. I just wanted to quickly show it to you. Next slide, please. And again, we want to make this also a quite practical webinar, and then that's why I decided to show you one example. And I use the example of the distribution of aid. And it doesn't matter if it's food, if it's non-food items, if it's cash. In all this distribution of aid, the amount, or let's say the probability of sexual exploitation and abuse is very, very high. And this is the example I'm using from the Empowered Aid research that was done in Uganda and Lebanon, and we will also share the resources with you. And it is important to see that sexual exploitation and abuse can occur across the aid distribution process. So often we think that the risk is at the actual point of distribution, but it's not the case. It starts much earlier. So from the moment, for example, women and girls receive information about aid distribution to the registration and verification process at the point of distribution, traveling to and from the distribution location, and when the aid is actually stored. So it's a continuum. So SEA is not happening in a vacuum. Next slide, please. So as humanitarian workers, we should review each stage of the distribution cycle, from informing the communities to safely transporting aid home, and to examine where risky situations can occur and take actions to address them. And this can really prevent abuse from happening. And this is what we call the contextual safeguarding. And again, recognize that people in the communities are themselves experts in contextual safeguarding. they know their risks because they go through their risks every single day. So you just have to listen to them, and they will tell you exactly what the risks are and which will help you then to mitigate it. And also in the mitigation, you include them. And be careful, and it's something that is often forgotten, be really, really careful when you are collecting biographic or demographic information. And it's crucial because if an enumerator or someone at the verification stage asks, let's say, for the marital status of a woman, and the woman says, I'm a widow or I'm a single mother of 3 kids, this person already knows how vulnerable this person is. Because we know that there's no man in the house, there's a single mother with 3 kids. So ask yourself twice if certain information is really, really relevant. And if it's relevant and you have to ask it, then make sure that the people who ask the questions are supervised well and are trained well, and data is dealt confidentially. Yeah, especially when sharing this eligible data during your verification processes. Yeah, so you need to really supervise enumerators and data people because information is power, we know that. And we have seen it in the past that certain information could lead to abuse because people knew exactly where this woman lives and that she is alone. So think twice, that's really, really important. The next slide, please. I also wanted to show you some of the voices that particularly the women in Lebanon and Uganda were sharing with the research team of Empowered Aid to also show you that by basically listening to them, it already gives you quite a lot of answers for your program design. And often it's very simple. So one key thing is sex-segregated lines at distribution points for women and girls to avoid them being pushed out of line, being harassed, or being targeted. It's not very difficult to do. I mean, we all know sometimes it's hard to organize and structure communities during a distribution. It can be very hectic and chaotic, but it's something that is really key. Also have more women aid workers or women committees involved in aid distribution processes. Look after transportation support. Yeah, do sessions with communities and explain them what the expected behavior of humanitarian workers are. Also implement close supervision and make sure that not one single person is responsible for an aid distribution. Yeah, so rotate, distribute power, because if the power is with one person, then it's likely that this one person at one point or another could exploit it. Yeah, and establish predetermined assigned times and make sure that it's times where it's not dangerous for women to come. And also sometimes it can be helpful to have formal and informal accompanying systems. Yeah, and these are all voices that came from communities. And another thing is when it comes to the rebuilding of houses, for example, and you have a lot of construction site and construction workers, make sure that when people go to houses of people that it's a mixed gendered team. Yeah. So this is something I wanted to show you, and we will share with you also the tools of Empowered Aid that you could use. So we are doing a bit of a jump now. Next slide, please. Because it's something that is very important also in emergencies. Is the trauma-informed approach or the trauma-informed care in safeguarding, and why is this important? As we could see, we saw on the images and we saw on the particular risk that I was going through, is we are in situations where we can assume that people have been through traumatic experiences. And it can result, and research has shown this also, that it's difficult for people to trust services or service providers. Service providers is us as the humanitarian workers. So services are structured and organized and delivered in ways that promote safety and trust. And this is at the core of trauma-informed care. So it realizes the widespread impact of trauma and understands potential paths of healing. And why am I saying this? Is sometimes when it comes to eligibility of people to certain aid, also in distributions, it can happen that maybe a person that is eligible doesn't show up in a workshop or doesn't show up at the distribution. And at one point or another, we kick this woman out because she doesn't fulfill the criteria anymore. There might be a reason why this person is not coming. And this can be related to certain consequences of traumatic experiences. And trauma-informed approaches also encourage organizations to train their staff in recognizing signs and symptoms of trauma among themselves, but also among the staff and among target communities. Yeah, and it was important for me to mention this, next slide, because working with people who have experienced trauma is a hard job to do, especially when you yourself are also affected. And it can result easily in vicarious trauma, or what we call also the trauma exposure response. Because if, let's say, you are maybe not been through a traumatic experience, but you are listening on a daily level to horrific stories, it does affect you. And it can be, next slide, it can be managed if you apply a trauma-informed approach. Next slide. If you have strong workplace and social support systems, and this is the duty of care and staff well-being, and it's a huge part of safeguarding. We sometimes don't see it, but it's really, really important. Yeah, so that we have staff that is trained to recognize those symptoms, but is also the organization takes care of them, that they stay healthy. Yeah, so there's adequate level also of supervision involved. Next slide, please. Vechtan, you already want me to come to the advocacy to donors?
I think, let me just, thank you very much, Claudia. Yes, but the idea is by articulating why we need safeguarding in onset crises and complex crises to what we need to know. And you moved greatly to what non-governmental organizations, including NGOs and CSOs, need to do, considering or thinking of all the package that we are giving to the community, from do the risk assessment, the duty of care, consider the trauma and, let's say, survivor-centered approach, in trauma-informed approach, safe recruitment, consider minimum standards. All of these requirements are crucial because humanitarian assistance comes with dignity and safeguarding everyone, including anyone who interacts with our interventions. But Claudia, how can we make sure that let's resource CSOs, community associations, in addition to NGOs, have the technical and, you know, the budget, technical capacity and budget to implement that? And here is the role of donors. So what I want you now to emphasize is what donors need to do to support the implementation of safeguarding during emergencies. And over to you back. Thank you.
Thank you so much, Vechtan. Yeah, it's really, really crucial. And I'm not sure if we have donors among the participants, but it is very, very important to do a proper advocacy to the donor community. We can put yes. So in this particular emergency, the earthquake in Turkey and Syria, we know that CSOs, or also national organizations, international organizations, they were and they still are the first responders. And they are strongly, strongly affected by the earthquake themselves. So they do have to do the job being the first responder. At the same time, they also lost everything. So they need financial and human resources to be able to run their operations and to put safeguarding measures in place. And if we looked at what we need to do through safe recruitments, through assessments, through operationalizing all our policies, we need to have budget. And I would suggest that at least 2% of the budget and of each subsequent proposal should be allocated to safeguarding costs. And this includes human resources. And I know donors sometimes have a bit the tendency to fund activities, but activities need to be implemented by human beings. So we need staff, and enough staff, because in an emergency, different than in a development context, you have to rotate people. People need their time off because they cannot work 24/7. You're going to burn them out. So you need more staff than under normal circumstances. In the early stages of a crisis, as emergency actions are undertaking, and it's often about life-saving measures, safeguarding systems can struggle. So civil society organizations, they need external support, sometimes by external consultants, sometimes by mentorship, and this also costs money, but it's well invested money. So I can only encourage to really put safeguarding as a priority when it comes to emergency funding, because you have to go through your safeguarding self-assessments, you have to assess partner organizations, and it's not about assessing them and then not filling the gaps or helping them to reach a certain level that is needed. Next slide, please. And this is something I also discovered over the years, or I saw over the years, is that a lot of safeguarding services are either preventive, so we put emphasis on writing a lot of policies, training and doing induction, and it's all good, yeah, so it's all crucial and important, or we are very reactive. So we do our investigations or post-event reporting, but an emphasis should actually be put on proactive measures, because this is crucial, because communicating to communities on how to spot signs of harm, encouraging early intervention, and training organizations how to discover harm rather than wait until it's reported to them is really crucial, because we know there are signs of harm that can be identified early, and there are also work environments that make it more easy, let's say, to abuse power. And so we do have to invest into proactive measures. And this is also costly, and donors have to fund this. And we have a collective responsibility for safeguarding and need to invest in the resources required to actually operationalize our responsibility to accountability towards the affected population, because that's what it is. We have to put everything that we nicely write into policies and our code of conduct and everything, we have to put it in practice. And it needs to be put in practice by human beings, and it requires resources, and it requires time, and it requires knowledge. So sometimes civil society organizations also have to consult external consultants to help them. So I can only encourage donors to really invest in this, because it will save you a lot of money later on if you do it right at the beginning. So thank you so much, Vejdan. That's it from my side. Over to you.
Yeah, thank you, Claudia. It is really very useful presentation, and we have a number of questions. Before I go to some questions, I would like to highlight that if we can't address everything in this session, we will cluster all questions with the right answers and publish with the webinar. So let me just take some let's say, questions, but before I direct any question to you, I would like to address very important comment from one of our audiences there, saying that it's a great webinar, and useful for everyone, but unfortunately, it is inaccessible to deaf participants. There is no sign language interpretation. That is right. We consider accessibility, and that's why in our registration form to the webinar, we ask about, do you need support or any accessibility? Do you need that type of support? If all responses come to us with no, then we don't provide service, but it is considered, and thank you very much for highlighting that, Mr. Suleimani. One important question about the difference between safeguarding in emergency and in general settings. Is there any difference you'd like to highlight, Claudia?
I would say there's not a big difference. The only thing that you need to consider is that in emergencies, the safeguarding risks diversify and multiply. There is just more in a very short period of time to address. And there is much more pressure. And in terms of staffing, and that's the difference when it comes to emergencies, there is a possibility of an increased level of harmful behavior because you are hiring a lot of new staff. And in a more development context, you have a more continuity of staff, so you know with whom you work. And I would say that's the biggest challenge, that there is an influx of new people coming in. Yeah, but in general, the safeguarding risks are very similar.
So risks are common and similar, but when it comes to how severe the situation is in a crisis is, let's say, severer. There is another, let's say, great question around, as you mentioned earlier, community engagement is essential when it comes to safeguarding. Hence, could you please provide us with advanced training on accountability to the affected population? So I think that is, to us as the Resource and Support Hub, we always include aspects of accountability, and that's why we established that hub, because we are accountable to our donors, we are accountable to communities, and we're accountable to the aid sector in general. So yes, the accountability to the affected population is something that is integrated in all of our tools, but we don't give a specific training related to the accountability. Thank you for that, Jessica, and it's a fantastic point. Anonymous attendee asked, what advice, Claudia, would you give when working with organizations who have never really considered safeguarding at all?
I think, first of all, maybe those organizations are not fully aware of the concept of safeguarding, which does not ultimately mean they are not doing things that are good. So I think it's very important when you work with organizations to maybe leave behind a bit the terminology, but look at what are they doing. And maybe they are already doing a lot of safeguarding measures without knowing. You know, sometimes it happens because they don't know the concept and it's new to them because they are new to the humanitarian sector maybe, but it's really good. And for this, we do have these self-assessment tools which guide you through an assessment with a partner organization, which helps you then also to identify certain gaps, which already gives you a plan of action and which gives you a journey to work together with this organization to implement safeguarding. So I would never say, don't work with them. You know, you have to dive deeper and look what they have. Yeah, because sometimes it's also more about the attitude that someone has than having a written policy in place. You know, the attitude is more important because the policy can be written later on. Yeah.
Yeah, thank you. We still have 5 minutes for two more questions. One is about how the preventive and proactive measures are distinguished, and what are the proactive measures different from the preventive and responsive.
Yes, as I said, for me, the prevention is really, let's say, you are having a code of conduct. And you are recruiting new staff and you're going through the code of conduct. This is preventing this person from potentially doing harm. Proactive measures are, if you, let's say, go in a community and you tell them and you teach them or you work with them to identify certain harmful behaviors and you let them do it. Because maybe we assume certain harmful behaviors and certain signs, but maybe they see it differently. So there's a difference of doing a community awareness raising session on PSEA, like very detailed on exploitation, abuse, and harassment, or going with open-minded in a community and work with them on identifying signs of harm. That's for me the difference between prevention and being proactive.
Yeah, thank you, Claudia. Another question directed to you, which is, Claudia, what would you propose as a best practice around complaints mechanism that are child-friendly, that can be accessed outside learning institutions?
For child-friendly complaint and response mechanisms, similarly with all types of community engagement, and depending, of course, of the age of the child, but it is important to use child-friendly participatory measures and work with children together on those complaint response mechanisms. So include them in the design of your complaint response mechanism, and maybe don't use words like complaint or response and all these words that are maybe very hard to capture for a young child. Of course, if children are really, really young, they would also not raise a concern. They have to have a certain age, and you have to find ways how they can disclose certain information to you. So maybe a box is not the right thing because maybe they're not able to write. So the only thing I can say, because we do have a lack of time, is to use participatory child-friendly measures to work together with children. And there are tools that I'm sure also we can share with you later on, but it would require an own webinar to really go into depth of this.
Yeah. We have some comments around what type of tools we have when it comes to integrating the safeguarding part in proposals, and I would like to highlight that our colleagues from the Resource and Support Hub will add a link for a webinar that implemented this week, actually last Monday, for CSOs in the region and Yemen. It speaks about how to integrate the aspects of safeguarding in the proposal. Let me just navigate a little bit about, there is one question I think from Turkish-based agency asking about the difference, Claudia, between the code of conduct and the safeguard.
So as we know, this safeguarding is an approach. It's a tool set of very practical measures, and the code of conduct is one measure among all different measures that you have. And the code of conduct basically sets the values of your organization. So what are the principles and the values of your organization and your vision and mission statement, and what do you want for your organization, how people work with each other, and also how they behave towards the community. In a code of conduct, you also have elements such as anti-fraud and anti-corruption that are not necessarily considered safeguarding. So a code of conduct is a set of, let's say, rules and regulations that the workforce has to apply that goes beyond just safeguarding measures, but it's one tool of the overall safeguarding approach.
Yeah, maybe that will be the last question that we're having. Very important point in including safeguarding and risk assessment. Has any similar exercise been done tackling Syria? I think maybe we can just say, when it comes to the context of Syria, the Resource and Support Hub done its country assessment to the context of Syria before even we design our activities or intervene. When it comes to the assessment, project assessment or organizational assessment, I think this is something within either the cluster or the organizational responsibilities before they intervene with the community. And I would like to highlight that in the context of Turkey and Syria, there are more than 40 tools in different languages that you can use when it comes to how to mainstream and what is needed to be done and what type of questions I need to ask when it comes to the risk assessment, in addition to the resource and support hub. And we have now an allocated page that we initiated right after the earthquake. It speaks about different aspects from risk to any other aspects related to messages, community awareness, and many beneficial tools in Arabic, English, and soon most of them will be translated into Turkish. With that, I think we need to, now my colleagues will share some questions on the feedback for today that helps us to customize and align our services. Would you please give 2 minutes or maybe less than 1 minute to answer those questions quickly? And in the meantime, I would like just Claudia, and it is not written in our script, just to give advices at this very critical phase to list resource CSOs. If they don't access budget, what is the minimal they can do as a recommendation from you as an expert in safeguarding?
So let's say if resources are limited, what can you do? I would say a thing that you really can do is make sure your own team is safe and stays healthy. I think we cannot stress this enough, how important staff well-being is, particularly in emergency. So make sure your staff has enough time off. Make sure in these very hard and difficult situations, you also have moments where you enjoy working as a team. Because the moment your staff is healthy and motivated, they are less doing harmful behavior. This is for sure. So this is something that doesn't cost money. Yeah, so I would really put an emphasis on staff well-being in this regard. Yeah.
Thank you for highlighting that, Claudia. Actually, it's really painful to know that the staff who's responding to serve communities nowadays are traumatized themselves. So staff care and well-being is very important. Thank you very much for this rich conversation. Thank you very much for the challenging and productive questions to us. I would like to highlight one important, let's say, answer to a question came in Arabic in the chat, which is, in the complex situations and safeguarding, will you be able to train us? Actually, for organizations who are now responding to the Syria and Turkey earthquake, we are organizing number of trainings for non-governmental organizations around safeguarding in emergency. So to know more about our upcoming webinars, tools, languages, and trainings, please subscribe to our newsletter link that our colleagues are adding now to the chat, and maybe you can contact Mr. Kenan Diab, the representative of Syria Hub, and myself. Our emails are on the chat. Thank you very much, Claudia, and regards of love and peace from myself, Wajdan Jarrah, and the Resource and Support Hub team in MENA region. Thank you very much, and see you soon.